Thank you so much, sir, for kind introduction and including me in this IC. And my topic is the role of artificial intelligence in retinal disorders except diabetic retinopathy. Diabetic retinopathy is one of the most commonly investigated disorder as far as artificial intelligence is being concerned. And it is one of the dream project of Google as well. Sundar Pichai has coordinated and collaborated with Arvind Eye Hospital, Madurai and Shankar Nethralaya, and they're doing a lot of research and study. And coming years, we may see some game-changing equipments as far as artificial intelligence is considered in retinal disorders of diabetic retinopathy. But apart from diabetic retinopathy, in other retinal disorders, most of the things are still in the research phase and at the phase of scientific calculations and research. So nothing much is available clinical, but I would try to rush through each one slide of all important disorders like age-related macular degeneration, retinopathy of prematurity, iridomacular dystrophies, and systemic diseases. Retinal condition is systemic disease, and then investigations and ovarian disorders. So as far as coming to the deep learning in AMD, one of the most important fact we see through deep learning in AMD is evaluation of best corrected visual acuity, and structural changes and respective visual acuity in AMD can be tried to map. AI algorithm used to predict BCVA in AMD using deep learning techniques of advanced OCT images, SD OCT images. Even artificial intelligence can be used to quantify the geographic atrophy lesions, lesion segmentation, and then fluorescent property with respect to visual function, therefore allow one to improve progression and quality of life. We can see the nature of the lesion and its progression, and then we can say something or predict to our patient about the progression of the disease and quality of life. And in cases of this delayed rod-mediated dark adaptation, RMD is a factor which is a functional biomarker of incipient AMD. So a rod intercept time and macular SD OCT image analysis using deep learning or artificial intelligence showed hyporeflective outer retinal bands on macular SD OCT, which were associated with delayed RMDA. This agonistic approach to anatomic biomarker discovery strengthens the rationale of RMDA as an outcome measure in early AMD clinical trials, and also it expands the utility of deep learning beyond the automated diagnosis of fundamental discovery. Artificial intelligence in ROP is also becoming a newer modality to correctly screen and diagnose ROP, and it is actually automated image analysis and deep learning system for ROP, and it has potential to improve ROP care by improving the efficiency, accuracy, and objectivity of diagnosis, facilitating the quantitative disease monitoring and risk of prediction. And then development of continuous vascular severity score using IROP deep learning system has improved telemedicine and its use of AI in ROP diagnosis. AI-based telemedicine ROP screening can unburden retinal professionals, and it can reach to far-flung areas where the ROP screening facility or expert is not available. Artificial intelligence in ROP diagnosis has actually the convolutional neural network based on wide field fluorescein angiography for ROP, that is that RETCAM based fluorescein angiography has shifted focus from posterior pole to peripheral retina. Like currently also we are having good RETCAM which scans the periphery, and we can do fluorescein angiogram as well. So now further studies and FA based AI algorithm are required to revise the criteria of ROP treatment. Then apart from this ROP and AMD, artificial intelligence in dystrophy and degeneration has also been used, and it has been used to automatic identification of ellipsoid zone in retinitis pigmentosa, to quantify a structural deficit in RP for detecting disease progression and for evaluating treatment effect. Open source convolutional neural network, that is CNN, is in artificial intelligence automatically identify cone images in choroideremia, and it can prognosticate easily with respect to manual counting. Retinal imaging in AI in systemic diseases. Some of the systemic diseases can also be identified using artificial intelligence through retinal images, like cardiovascular diseases. Retinal vascular morphology changes can predict any clinical systemic disorder before they appear in the body. like vascular, by measuring the retinal vessels through vascular caliber and vascular tortuosity. Why there is an advantage in retina? Because retinal vessels are the only vessels in the body which can be seen with the help of instruments or can be imaged without dissecting that particular organ. We can directly image the retinal vessels. So any vascular changes in retina can be picked up by retinal imaging system. And by using artificial intelligence, we can predict those changes in retinal vessel, and we can assume that these changes are simultaneously being happening in other systems also, and they can appear as a cardiovascular disease or coronary artery disease or whatever. In neurodegenerative disorders as well, like Alzheimer's disease, there is reduction in vascular indices, retinal nerve fiber layer, and retinal ganglion cell number. Even in dementia, the retinal vascular morphology changes and peripheral erosion can be identified, and they can predict of dementia. Then dye-free method to assess thiophelmin positivity of retinal amyloid deposit from their images in polarized light can predict the presence of early stages of Alzheimer's disease. Retinal fundus image can also be used by deep learning algorithm to predict high CACS, coronary artery calcium score. The visual pattern of retinal fundus image in subject of CACS more than 100 can be recognized by deep learning algorithm compared to those with no CAC. And in an inexpensive radiation-free screening method for patient at risk of coronary vascular disease. So deep learning classification and model demonstrate the feasibility of automatic classification of ultra wide field fluorescein angiography image quality, and clinical application of this system will greatly reduce manual image grading workload, allow quality-based image presentation to clinicians, and provide near instantaneous feedback on image quality during image acquisition for the photographer. AI-based segmentation of retinal layers, like early diagnosis of retinal disease and monitoring clinical retinal disease. AI permits more accurate overlay of fundus.
Prakash, just conclude. Otherwise, there is a next speaker. Also.
Yes, sir. I have just 1 or 2 slides. So retinal hemorrhage can be a sign of many ocular and systemic disorder, and as a screening tool, automated system based on wide field fundus images may add early diagnosis and management of retinal hemorrhage related to retinal and systemic disease, allowing timely referral. AI can also be used to predict a scan or predict uveal melanoma using digital image system, and AI can be used very well in cases of vitreoretinal educations like deep CNN, and then these all outfitted with deep neural network mobile devices can potentially extend the reach of ophthalmologists outside the clinic and provide low-cost universal access to vital diagnostic care. So thank you so much.